decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back, and we're talking about how to live better quality of life, how to navigate the medical system, how to get better cancer care, how to understand what your doctor's talking about, because so many issues are communication. And really, one has to communicate to understand what each party's talking about. The doctor, us, serves as the advisor to you. You're the chairman of the board. You are the president of the United States of your body. You are in charge. And you can come to us or someone else as your advisor and try to understand what we're talking about. And usually before I leave each patient, I'll ask them several times, do you have any other questions? So I want people to have a chance to ask all their questions. They go away with my phone number. They know how to find me. Their family can find me. And we think that's the way that there's a communication and the best understanding between us, the doctor trying to treat the cancer, and the patient who is actually suffering with the cancer along with their family, the family who often suffers even more. We had an interesting woman who came in this week. 72-year-old woman, widowed with 3 children, 4 grandchildren, beautiful woman, beautiful daughter. She presented with disorientation, so she was a little confused at work in September 2012. She went to the emergency room, had a chest x-ray, was found to have lung cancer with brain metastasis. She had gamma knife treatment elsewhere. She had chemoradiation to the lung over 12 weeks. Then she stopped the chemo in January 2013. She was never in remission. In March 2013, she had more chemo. The cancer didn't budge. And then she's starting chemo again last month, September, with a new port. And she's had this cough getting worse. She's had this cough with supposedly inflammation in her lung. Her arms and legs are fine. She's had some cramps in her legs. Her PET scan showed progression of the cancer in the right hilum. What is a hilum? Well, the lung takes in air, right? When you breathe. Air comes in, air goes out. Well, there has to be a way for the air to get in and out. Well, it gets in and out through the hilum. There has to be blood to get in the lung to take that oxygen to the rest of the body, and there's the blood to get out. Well, the hilum is kind of like the door to the lung. Well, she has a big mass in the hilum obstructing the airway. And she has a mass in the subcarinal area. The carinal area is where the airway divides into the right side and left side. So she has progression of her cancer where it counts, unfortunately, the most, and that is in the brain and in the lung, hilum, and carinal area. And these were all progressing. Even in June 2014, her doctors knew elsewhere that the cancer was growing in the supraclavicular area, and she had more swelling in the brain, and nothing was done. Well, the swelling in the brain was either toxicity from gamma knife or cancer growing. The supraclavicular area was cancer growing, so it's very suspicious that cancer is growing both places. Now she comes in with cancer growing everywhere, the brain, the hilum, subcarinal, and she wants a new opinion. She wants a fresh opinion. She's had chemo 3 times. It hasn't worked. And chemo usually gets less and less effective with time. Cancer is very smart. Cancer can modify. Cancer can mutate. With radiosurgery, because radiosurgery works in billions and billions of different ways, the cancer can't adjust. It can't mutate to resist the radiosurgery. So that's why radiosurgery is so effective in our hands, and we've had the largest experience, the longest experience in the Western Hemisphere, in America, in New York, even on Broadway. So if you want to have a chance, you may want to give us a call. Our office number is 212-CHOICES, 212-CHOICES, which is 212-246-4237. If you want to speak to me, I'd be happy to speak with you, but the best is to come in and talk in person and discuss your case. We'll give you all your documents. You'll see what you have. If you need other testing, we'll talk about that. We'll explain it to you. We'll take all your questions. We'll answer your questions pretty much no matter how much time it takes. And another example of a similar woman came in with esophageal cancer this week. Now, she's about 60. She was born in India. She developed esophageal cancer. She went to the big famous cancer hospital. She had chemo, radiation, and surgery. They even cut out her esophagus after chemo radiation. And then the cancer came back. Well, it came back in 2 spots. It came back in exactly the 2 spots where the surgeon operated on her. It came back where he cut the esophagus to remove it. It came back where he cut the chest to reach his hands in to remove the esophagus. It came back in those 2 spots. Well, elsewhere they were going to do more biopsies and more tests, and then more of the same treatment. And she was fed up. She came for a second opinion. She came about 6 months ago. We treated her about 6 months ago. She had radiosurgery, 5 treatments. It's all non-invasive. We make a special stereotactic frame for the patient. We aim the beam at the cancer, give intense treatment to the cancer, leave the rest of the body intact. She had no side effects. She got up, went home, did her work, was with her family, her husband, her loving son, had 5 treatments, came back in 3 months, new scan, in remission. Comes in 3 months later, in remission, gaining weight, pain is gone. She was having trouble with her voice because where the cancer came back by her esophagus cut. Now her voice is back without any manipulation. Her pain is gone without any medicines, just with those 5 radiosurgery treatments to each site of disease. She is happy. She was a woman that came 3 months ago. She went to her doctors with this PET scan showing complete remission, and the doctor was speechless. The doctor didn't know what to tell her. Well, this is what we often see at Radiosurgery New York. Often we see great results after radiosurgery. We believe in it. Why do we believe in it? Well, number 1, there's data. Number 2, experience. We've been at radiosurgery since I've been involved in radiosurgery since 1986. So we have a long experience. We have the experience of a background in internal medicine, medical oncology, radiation, and it's all to your benefit. You get the benefit of the doctor's long experience with about 20,000 cases treated. You get outpatient treatment. You avoid the problems of hospital. You avoid the super infections of hospital. You avoid the super bills of hospitals. our work, and it was recently reported in AARP that if you want radiology work, you should go to a private center. The costs are about half of what it is in a hospital. So there's many, many benefits, and you have your own doctor. Not a drive-by, not a student, not a resident. You have your own doctor. So this is Dr. Lederman. We're going to say goodnight in just a few moments. If you have questions during the week, please call us at 212-246-4237, 212-246-4237. I look forward to meeting you in person. Thank you for listening. God bless you, and good night. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas